Good afternoon and welcome to NOCC's Ask the Expert series today. I am Alana Feuchter, Patient Insights and Advocacy Advisor, and today we will be talking about fertility options and ovarian cancer. I'd like to remind everybody to please feel free to chat in the chat box. Let us know where you're from and if you have any questions. Just to let you know what we are hoping to accomplish today, we would love at the end of this if you have a better understanding of the questions that you should ask your healthcare team when you are being diagnosed about fertility options. And we're going to discuss a little bit about the variety of options that are also available, both before and after surgical menopause, and strategies for the psychosocial impact that fertility loss may have after an ovarian cancer diagnosis. Today, we are very fortunate to have several survivors share their story with us, along with a professional who has dealt with fertility issues in patients for quite some time. So I would love to begin by introducing our survivors. Let's start with Molly Irwin. Molly, if you wouldn't mind, if you would just tell us a little bit about yourself, your diagnosis, the time that the age that you were diagnosed, and any discussions that you might have had about fertility preservation.
Sure. I'm Molly. I live in Boston. I'm a licensed social worker. I operate in private practice as a therapist working with young adults. I was diagnosed in June 2017 at age 29. My diagnosis was stage 3C, high-grade serous primary peritoneal cancer, which is a rarer gynecologic cancer that gets put under the umbrella with ovarian. And in the very beginning of my journey, when I received the diagnosis, I also received the news that I would not be able to save or preserve any eggs going into my full hysterectomy that I had to have. At stage 3, it had already spread. It was just too far gone at that point. I asked. I was not told about options. I asked myself. My mom might have asked. I can't quite remember who was talking at the time. And, he went off and consulted with someone, came back and said, no, unfortunately, we can't preserve your eggs. So unfortunately, in addition to my diagnosis, I received the news that I'd never be able to have biological children. So that is where my journey starts if I were to want to have children.
Thank you. And I'm sorry that that wasn't the case. But thank you for sharing your story with us today and helping empower other women who are going through this as well. Noelle is also a survivor. Noelle, do you want to share the same information about yourself?
Sure. My name is Noelle. I'm a school teacher, third grade school teacher. I received my diagnosis at the age of 34 in July of 2015. The diagnosis didn't come until right before my surgery, so they didn't know it was cancer until the surgery. They still weren't sure what type. So prior to even going under the knife, I had to sign away my reproductive rights because I wasn't sure what I'd wake up with, whether I would wake up with anything or nothing. And in that moment, that's a very hard decision at 34, still young enough to have children to make. I was lucky enough to wake up with one ovary. I did have germs, stage 2B mixed malignant germ cell cancer. Naturally, my phone rings. So they were able to save the left ovary. I was given 2 weeks to do fertility. So I only was able to do one round where I was able to preserve 8 eggs. Whether those eggs are still viable now, I'm sure they are frozen. The option was told to me. I didn't make the choice. My oncologist suggested it and I went with it. I did go through obviously menopause surgically, but also after I'm still perimenopausal now. So I do have eggs if I want to have a surrogate, but I could carry if I wanted to. But now I'm 40, so those decisions are still hard.
Thank you for sharing that.
The one time.
This question I'm going to throw out for both Noelle and Molly. If you were if you were to talk to another survivor, is there something that you wish you'd been told or known to ask about fertility?
I mean, in my case, the real heart of the issue was that it was caught too late. So, you know, I'm very strongly opinionated. I have strong opinions about early awareness and early detection, because if we had caught it sooner, there was obviously a much higher chance of at least preserving eggs. There was never a chance for me to carry my own biological children. A full hysterectomy was necessary by that point. But, you know, I think that the reason I was not able to preserve was because of the lateness that they caught it. And I think, you know, the doctor didn't bring it up because he knew it wouldn't be an option, but, you know, we kind of made him double check anyway. So I think if you're someone going into it and they don't openly say you're too far gone, then 100% fertility should be in that very first conversation. If you're diagnosed, you know, at an age where you either haven't had children yet or at the childbearing age, you know, it should absolutely be brought up by doctors first thing.
I agree. Because they didn't know what was going on with me. It was never suggested or even a thought from just my regular gynecologist when the process of trying to figure out what was wrong was going on, to even just go through a round of fertility before any type of surgery, just to preserve what I could. Because again, the option may not have been there for me if results were different. You know, being a little older than Molly, you know, just in your 30s, when you're a woman, that whole idea of preserving your fertility should be brought up, I think, just naturally by gynecologists. Because as we get older, we know that we produce less eggs, and, you know, the viability of them isn't as good as you get older. So I think just anytime a woman is going through something, whether it's cysts, POS, polycystic ovarian syndrome, just the making sure that females have the opportunity to do something about their fertility before it's lost.
Those are good points. Good points. I want to come back to you both in a second, but I'd love to turn it over, ask a question of Meghan Sollinger, who's with us from the Ulman Foundation. And you both had kind of hinted on this, that you know, you want women to know what their options are. And the ASCO guidelines state clearly that all cancer patients of childbearing age should receive information about fertility preservation options. And yet we know that this doesn't always happen. So what can we do to ensure that this is an option for women who may be diagnosed with ovarian cancer at some point?
Yeah, so the ASCO guidelines that you're referring to, it's the American Society of Clinical Oncology. They came out with guidelines in 2006, and then they continually update them, which they updated in 2013 and 18. And the most recent one says, and it's been updated, instead of just saying the oncologist should bring this up with their patients, it now refers to anybody on your medical team or part of your support team at, you know, your institution where you're being treated. And so the onus is not necessarily just on the oncologist. It should be on anybody on your medical team. So it could be a social worker, a navigator, a nurse practitioner, someone on the team. The complicated part of that is that, you know, there's so many different people who could be having this conversation. So it's sort of up to the institution to designate who that is. And I have to say, like, so I was a patient navigator with young adults. So AYA, the adolescent and young adult patient population, by definition, is ages 15 to 39. And that's a pretty standard age range. And that is defined by, those are the reproductive or childbearing years. So any patient that is being diagnosed or potentially being diagnosed with a cancer diagnosis between the ages of 15 and 39, by virtue should automatically be someone should be having these conversations with them. The ideal is that 100% of patients, when they're first diagnosed, are at least being told that there is a chance of infertility with whatever treatment, surgery, radiation, chemo that you might be on to address the cancer diagnosis. But in reality, that's not the case. And so there's lots of reasons why the conversations are not being had at 100%. So sometimes it really is up to the patient. And a lot of times the problem is patients don't know. So I can tell you, I've had so many conversations with people, again, as someone is diagnosed, a fertility consult, and I mentioned that you may become infertile either temporarily or permanently with them. And the just sheer shock that this is even something that they have to consider. A lot of people, just pure education, do not know that this is a potential side effect of a life-saving treatment. So yeah, I mean, ideally it is the medical team's responsibility to have someone bring that up, but in reality, that's not always happening. And so that's why we're doing things like this, like a Facebook Live, and just educating people that you do kind of have to be empowered to speak up, because it got you here in the first place. Something wasn't right. You know your bodies, and you should also know what is about to happen to you.
That's a great point, and leads into my next question, which is, do you have certain tips when you want to talk to your doctor about this, bringing this up?
Yeah. So I'll say, coming from like a fertility preservation, like a consult that I have with patients, this is the ultimate icebreaker is what I call it. Whether someone brings it up to me, I'm always very impressed by the fact that someone has, the courage or just the wherewithal to ask about it, but also bringing it up with someone, I think, is a great icebreaker, because the cancer process is very personal. And if you can have these tough conversations with someone you feel comfortable with, right? So it may not be your oncologist, it may be a social worker, it may be someone on your support team who can help speak up on your behalf. Those are always really helpful to find and identify someone that you really trust on your team or in your support system to help you have these conversations. So, in the times of COVID, you're not always able to have someone in the room with you or have a visitor with you at appointments. So sometimes you really do have to, just bite the bullet and ask the questions that you want to know the answers to, because the medical team cannot read your mind. So especially when it comes to fertility, just ask the questions. You're not going to be the first person to ask them. You won't be the last. But that's what you have to do, is ask questions. Or if you're in this situation where you can have someone in there with you, I would definitely say have them help either prompt you or help you ask the medical team those questions.
Are there specific questions that you should be asking?
Yeah, I mean, I would say there's probably 4 sort of just very basic questions, but they get a lot of, they're really indicative of you being interested in the fertility preservation process. Whether or not you go through it or not, that's a whole different, situation, but just asking, what are my options? A lot of times the medical oncologists, they're not reproductive specialists, and so they may not be able to tell you. In that case, they can also refer you. So you can also ask the questions, can you refer me to someone who I can ask these questions to, and that I can actually find out what my options are. I would also ask, with your medical team, your medical oncologist, do I have time to pursue fertility preservation? For a woman, like many things, it's way more difficult than for men. So fertility preservation itself can take 2 to 4 weeks for a female. And so do you have that amount of time is what you need to be asking your oncologist and your team, if you even have the time to pursue fertility preservation. And then what are my risks of infertility? So there are lots of different factors that could influence fertility status, things like age, what medications you're on, the doses, whether or not you're getting radiation, surgery, all that kind of stuff. So what are my risks? And then kind of going from there and figuring out, okay, I have this information, now what do I do with it? So I would say those are sort of the 4 questions to kind of at least get started with the conversation.
My next question is, can you talk a little bit about some of the options that might be available if someone doesn't have the opportunity to preserve their eggs or other body parts essential for carrying a child?
Yeah, so a lot of times, regardless of the diagnosis, we all have different factors and values and make decisions with the information we have, whether it's, time is limiting us or we're just not interested. So there's lots of reasons why someone may not be able to pursue or not have pursued fertility preservation when they were first diagnosed. Fertility preservation isn't a conversation that you only have when you're diagnosed. It can be something that is brought up multiple times along the cancer continuum and journey. What are my options? And just kind of your medical team, keeping you in the loop as to when maybe this is the point in time when you do go see a reproductive specialist. Those doctors are called reproductive endocrinologists, or REs. And so visiting a reproductive endocrinologist is probably the best way to figure out what your options are. I always tell patients, a lot of fertility clinics do free consultations for cancer patients or for oncology patients, and they also expedite the process, so they could get you in there sooner. Bringing a list of your medication and things that you've been on can also basically inform the team, the specialist, as to what your options are and what your best chances of creating a family and in what capacity. So the different options are, obviously you can, a lot of people do fertility preservation and either complete their family or don't end up using all their eggs, embryos, or sperm samples that they have stored. So a lot of times they will donate them back to other families who are not able to have biological children, which is always just a really wonderful option when you don't have the ability to have a biological child. So whether or not you can carry or not yourself, you have options to get donated eggs, embryos, and sperms. And then also surrogacy, there's adoption, there's fostering, and then there's also, of course, just choosing to be childless and doting on, friends and other family members' children as well. So, I mean, there's lots of different ways that we can create families. It doesn't necessarily mean that they're any less your children, or especially if they're not biological. But if for you having a family, there are lots of different ways to kind of create those families.
I'd like to kick it back to our survivors for just a moment. And we had this discussion kind of privately, but I think it's important for us to also have this openly, is that there's many emotions about the loss of fertility, and how often, especially as survivors, we are asked questions at routine exams. For instance, when was your last menstrual cycle? Is there a chance of you being pregnant? So, this is routinely asked. Maybe your gynonc isn't asking that because they know, but if you're seeing any other physician, they will be asking those kinds of questions. So Molly and Noelle, maybe if you wouldn't mind speaking a little bit to, how you manage those constant reminders.
So for me, because I still have my left ovary, I still do sort of get a menstrual cycle, but it's very inconsistent. So those questions do come up. My emotions to it it goes either way. Sometimes I'm like, well, can't believe, this is where I am in life and this is what's happened. But I'm not the person to dote on the negative. I always try to see the positive in things. But, bringing it back to the emotion of when I had to sign my reproductive rights away, that was really hard. You never think that you're going to have to do that as a female, whether or not I wanted children, because of course that question is still up in the air. The fact that it was could be taken away, and I'm sure Molly can speak more to this, but the fact that it could be taken away is something that it's almost like part of you not that who you are, but like as a female, like we have the blessing to reproduce and recreate. And for that to just be stripped was very, very hard in the moment. So, for me, I'm in a slightly different situation, but those questions still do bother me. And the questions of, oh, do you have children? Especially at 40, that's always the question. How many children do you have? 0. It is very, I don't want to say it's insensitive because people don't know, but I think there could be more sensitivity training on approaching women with history of cancer before asking certain questions.
That's a great point. Molly, do you have anything you want to add to that?
I mean, a cancer diagnosis is enough of a trauma on its own. And then when you add on additional things like infertility, it just compounds the trauma, and it gives you more to grieve and more to process afterwards. Any commercial with a baby or a pregnant lady in it bothered me for like at least a year. I mean, still does once in a while. And to also be diagnosed and lose your fertility at 29 when everyone around you is having children.
Right.
It was also just a very difficult time to have that, go through that transition and go through menopause, and be dealing with all that. Yeah, I mean, I think similar to what Noelle said, it's not necessarily the actual fertility being taken away, it's the choice being taken away.
Right.
And you see, the younger the patient, the more you see this of having that choice. Because I hadn't, my now husband and I hadn't really had thorough conversations about it. We hadn't needed to, we weren't married yet. And we hadn't nailed down a decision as to whether or not we wanted children. And this took that decision-making away. It took that choice away. And that potentially was more traumatizing than the infertility itself. So that was what was really hard, was just losing that choice. And cancer is such a violation of our bodies, and to just have things like that stolen from us can be really difficult to process and like make meaning out of.
I'm so sorry. Meghan, perhaps you can offer some suggestions on or guidance on how a survivor can manage those feelings. Because as you said, like, you watch a TV show, you have friends, you know, how do you manage all of that?
Yeah. I mean, the fertility piece is something that obviously is very specific to the adolescent and young adult age range. And so I think it's something that, spoken or not spoken, is something that's really common. And so one of the biggest things I always tell patients is just find people or someone that you'll, again, feel trusted and comfortable talking to. I think that we all know, like, keeping things inside, emotions and all that kind of stuff is really detrimental, especially add on a cancer diagnosis and all the other things that Molly and Noelle mentioned, you know, adding on to the trauma of a cancer diagnosis. It's really important to talk to someone. So whether that's, again, someone in your support system that you trust, on your medical team, a professional. Support groups are wonderful. There's different types of support groups. There's more social support groups where you just kind of are with other people who are going through something similar that you're going through or have been through. And then there's also sort of your traditional sit around and talk about your feelings, led and hosted by someone who's a mental health professional, can also be really helpful. I've also seen not just sort of age specific or cancer, you know, disease specific support groups, but I've also started to see some fertility and infertility support groups out there. So there are topical support groups that are out there that may be really helpful, especially as you're navigating some of these added layers to a cancer diagnosis. And so I think the really important thing is to know that you're not alone. And as a navigator, some people entrusted, you know, these conversations with me, and we would sit and talk, but it's always, everyone's journey is so different and what people need is very different. So what is supportive for one person is very different and may not feel supportive to someone else. So just knowing where to go to help you help yourself is going to be probably the biggest piece of advice I can give you. So again, back to the medical team, someone in the community. I mean, there's someone out there that can help you navigate this process, or you know who to go to help you find those resources. So just keep a note of who those people are that you feel comfortable with, and hopefully they can guide you in the right direction.
We do have a couple of questions, so I would love to, from the audience, so I'd love to ask those in the little bit of time we have left. Someone asked, does insurance cover the cost of preserving eggs? And Noelle, it looks like you were saying something.
So I'm very lucky that I have, as a school teacher, I have good health insurance, and my health insurance has a limit, but in order for them to cover it, I had to call the insurance company and explain that I had a cancer diagnosis, that the reason they were covering my fertility was for a cancer diagnosis, which for someone newly diagnosed with cancer, having to make that phone call and that the insurance company just doesn't believe that the medical notes and everything, that you have to physically call, was very difficult. But I do know that there are lots of insurances that do cover it. And unfortunately, there are some insurance companies that do not cover fertility treatments. And I know that it can be very expensive to go through fertility treatments of any sort, preservation or anything. So definitely something to think about if you don't have a cancer diagnosis, but really making sure you call and you fight with your insurance company to get the coverage that should be given to you with a cancer diagnosis.
Yeah, just add a couple of things about the insurance piece.
Yes.
So a lot of companies and insurance policies, unfortunately, do not have fertility or infertility clauses or riders or any additional plans. The best way to find out, and unfortunately it's like calling, your utilities people and, being on the phone forever. Last thing you want to do is call your insurance company, but that is the best advice, is to call your insurance company, find out if you have any fertility preservation coverage or infertility coverage, whether it's some or partial coverage or full coverage. Again, only your insurance company will be able to answer that. Some states, I believe now there are 11 states across the US that have mandates that insurance companies cover the cost of fertility preservation in order for someone to start treatment. So it doesn't cover the storage and it doesn't cover what happens at the other end, survivorship down the road, anything like that. So seeing if your state has something like that. So the Alliance for Fertility Preservation is a great website. They have also some petition ideas. If you need to petition your insurance company, like you said, Noelle, call them, prove to them, make a case for yourself. The tricky part is a lot of insurance companies and policies have clauses for infertility, but you're not necessarily infertile at the time that you're calling and about to start treatment. You are what's going to be called iatric infertility. And it basically means what the cancer treatment is doing to you to make you infertile. So at the time before you start treatment, you're not infertile. So a lot of companies won't cover fertility preservation or anything related to infertility because at the time of diagnosis, you're not infertile. So it's really complicated and it unfortunately does take a lot of sort of fighting with insurance companies, but there are advocacy groups out there and things like that that can definitely help with it. And help, maybe cover some of the costs, some programs and that kind of stuff. So
you led into my next question, which was additional resources for people to get information about fertility preservation or options.
Yeah, so anything like we mentioned before, like the ASCO guidelines are wonderful. So you can see what is literally written for practitioners to follow. And so you should know what should be offered to you. But things like I said, the Alliance for Fertility Preservation is a wonderful resource. It covers advocacy and sort of the legal aspect, as well as just advice and some resources. One of the other websites that I really love, it was created by F Cancer. It's called letstakecharge.org. And it outlines everything about fertility preservation in a very digestible, patient, user-friendly website. And it breaks it down by what are my options? If you answer yes or no to this question, it leads you down, a chart and tells you where to go from there. It also has a wonderful resource page. It gives you guidance on how to have the conversation with your medical team, the types of questions you should be asking. So it's sort of a one-stop shop for a lot of different resources. And on the resource page, it does give you different categories of resources. So if you're looking at adoption, or if you need financial assistance, or young adult connections and things like that. So I think it's a really wonderful website. That's one of my go-tos that I always tell patients about. So that would be one of the really sort of a really good starting point for resources.
Great, thank you. I know we're a little bit over time. I think we have answered the questions that have been asked, but I do want to say to both of our survivors, there are lots of comments about people who are very grateful to hear your story because it makes them feel less alone. And so I think that's, that it's healing for others. So, so many thank yous out there. Thank you, Noelle. Thank you, Molly. Thank you, Megan. And thank you, everybody who was out there watching. We will have at the end a quick survey, if you don't mind, if you have time to fill it out. And we hope that you will join us next month when we have our Ask the Experts again. We will be talking about cancer survivorship plans. Thank you and have a great afternoon.